Thank you, Christine. Thank you, Cancer Choices. This is my second time back. I so enjoyed this presentation, this opportunity to share some of my 41 years of practice in Chinese medicine. In the past, about 25 years or more, I focus more on the cancer care for patients. So many times, you know, patients, family member, caregivers ask, what do you do? I want to do something. Can you tell me how to cook? Can you tell me how to take care of my friends, my partner? So this is a very useful hands-on acupressure webinar. I hope you can take this in and start practicing. And there are some things that I will tell you what to do, what not to do. And like Christine has mentioned, when we go into the points, acupressure points location, which should be as accurate as possible, we can do them at the very end or in the middle because I am presenting the power sharing, the PowerPoint. Sometimes I can't see all of you in a little tiny window on my desktop. So maybe we will do that at the end if you feel comfortable or if you don't feel the sensation of the acupressure, then you should definitely ask me at the end and Christine give us the cue to go for that. And with that, and I also ask that you later, and I will be playing a short video, you may want to turn on your volume. And we did the testing. There was nothing wrong with our volume on our end. Often people say, we can't hear you. And maybe you try at this moment and to see if you can turn up the volume a little bit higher so we can hear that. You can hear the video. I wanted to do a short meditation. The reason is acupressure, whether you do it on yourself or especially on your loved one, it's a very sacred, it's a very meaningful, it's a very heart-giving moment. You do it on yourself or you do it on another person. You have to stay in a space where it's very peaceful, quiet, where the other person, the recipient, can feel your love, your qi, your energy flow. And you cannot do the acupressure, have the TV on or have your phone on or have like a room full of people. So this, I encountered that a lot, when I call to do house calls, the patient will have the music on, Mozart on, the soap opera on. There will be quite a few gathering, like we're having a party. And I usually tell them, everybody should leave the room. If you cannot, be quiet because you'll affect the recipient, you affect me. So to start with, I would like just to take maybe just a minute, a minute to 2 minutes. If we can all sit together. How wonderful would that be? And just close our eyes. Let's start now. And let the mind also relax, let your shoulders relax. If things start flowing into our mind, take a minute to slow down. I do not want you to go, okay, I'll come back in a minute. I'll do something else. I want to come back. No, we wanted to start this acupressure webinar. We are going to start. You have to follow, so rest and rest. And start slowly, drop in. And breathe. And relax your shoulders, your eyes, your ears. Observe your breathing. And tell yourself, I'm going to learn how to do acupressure. I'm going to learn how to do that well. And we can apply on it right away. Okay, that's good. Everybody can wake up now and we will start our slideshow. Okay, and some of the common side effects from having surgery, especially cancer surgery, whether it's a biopsy, pre-surgery, or post-surgery, before the chemotherapy, like once the chemotherapy the date has been designated on certain 3 weeks, every other week, or once a month, immunotherapy, target therapy, or radiation therapy, there are some side effects emotionally, some side effects from the medication, from the radiation. So let's see. I'm sure you already know many of them. Let's see if I've named all of it. As you can see, these are all the very common side effects that we encounter. Perhaps participants, you can take a look. What do you want me to pay attention towards the last 15 minutes when we have Q&A? You can go, okay, she did not cover enough on skin burns from radiation, or she did not cover enough on neuropathy, or maybe someone in the audience is currently experiencing some of these. That's due to the chemo treatment or the radiation treatment. Then you can ask me that later on. But these are just some of the side effects, some of the body's reaction that I've seen. Let's talk about using some very important, useful tools. Last time in February, I talked about using your constitution, how to eat if you have a yang body or a yin body, a hot body or cold body type. That applies the same with acupressure. You can do it on yourself or do it on others, but you may say, I don't know their body type. That is fine. I will teach you how later. So acupressure or acupuncture, acupressure comes from acupuncture, from this ancient 3,000-year-old medicine that is still being widely practiced throughout the world. So when we do acupressure, like why I encourage everybody to do a meditation before you do the acupressure on yourself or on others, it really comes down to that mind and body and touch and pressure and the message you send to the recipient, whether it's yourself or another person. So you have to treat it with ultimate respect. For instance, when you go to your massage therapist bring out the best all of themselves to work on you. You come in very happily to receive. Just think about all the people that you will be touching doing acupressure, the sensation, the love that you will care to bring that. So it's a very respectful when you touch someone, when they let you touch them. So acupuncture points, I have all the 4-figure. I also have my little acupuncture doll. Maybe it's not easy to see. You can see on the lines, there's little dots. Lines are different energy pathway, energy flow. And we have about 12 regular energy flow. Each energy pathway goes to each organ. And each dot you see on the slide, each dot is one acupuncture point. There are about almost 400 acupuncture points up to now. So in the 3,000 years, these 400 acupuncture points are still used today. So next, I'm going to show you a video that was done by China Daily, the newspaper company. And there are some acupuncture needle they will actually insert on people. So if you are needle phobia, not to worry. I hope you can watch and watch the show and you will know more about the depths of acupuncture. And then we will go into acupressure. Okay, here we go. Turn up your volume if you can't hear it. It's pretty loud.
Precise to the point to restore the power to heal. Acupuncture, an ancient Chinese medical practice, has been a remedy for countless patients for thousands of years. Before modern medicine came to life, ancient Chinese used stone tools to relieve pain. Over time, this instinctive practice evolved into a comprehensive and profound medical system and shaped the root of acupuncture. Acupuncture is a treatment that aims to promote the body's self-regulating functions. Its therapeutic principles are in line with the philosophical concepts of traditional Chinese medicine, which emphasizes holistic treatment, meridian adjustment, balance of bodily functions, and overall physiological well-being. Practices can vary in forms, including needle insertion, cupping, and scraping. Needle insertion, the most common method, is carried out by inserting hair-thin needles into meridians or specific points on the body, no vital energy. Practitioners lift, twirl, and rotate needles to unblock the flow of energy, restore yin and yang balance, and stimulate the body's innate potential to heal itself. Looking beyond China, acupuncture has become a global therapy. Over the years, acupuncture has seen many advancements in scientific research and modern medicine. It is now a mainstream alternative and complementary treatment for a variety of ailments. According to a 2019 WHO report, acupuncture is used in 113 of its 120 member countries, illustrating its widespread recognition and application. As an ancient Chinese medical practice with a rich history and deep cultural significance, acupuncture is an embodiment of profound cultural heritage and a holistic path to healing.
So that was a video that was done in China. You saw all these lines as you see on these lines here. So I have, if you look on the top, this is a gallbladder. What that means internally, it starts from the gallbladder. And then they have many branches that goes around the whole body, even down like this is like the IT band, the sciatica, right? Goes all the way down to the foot. This is a urinary bladder and this is a stomach. So I said earlier, all these lines are energy pathway. So they definitely have shown from thousands of years ago until anatomy started in China that they were going, wow, look at this person. For instance, someone may have a gallbladder cancer or gallbladder stone, and they will actually have this sensation in these lines. Like I always have pain in the rib cage. Of course, the gallbladder is on your right hand side, right? But they may also have neck and shoulder pain. They may always have this pain in the sciatica, but they couldn't tell what is going on. Or the doctor, they do surgery nowadays. You will say to the doctor, but I swear I have this pain right here, doctor, right here. And the doctor will go, but we did CT and MRI, we couldn't see anything. So it could be a meridian, the energy flow that starts from the gallbladder, that radiates out from the head down to the fourth toe. Somewhere in there, there could be some blockage. So we usually, as you seen in the video, do acupuncture, where you can do acupressure on the different meridian, different acupuncture points. So you may say, okay, I have bladder cancer. Does that mean I will have more bladder pain or the bladder meridian will be more painful? Yes, actually, yes. You will actually find that certain part in the bladder meridian, there's already weakness. But you may go, but I don't know if I have bladder cancer or prostate cancer, but I have this pain that wouldn't go away. So when we do acupuncture or acupressure, you will always identify if it's a physical being that's being, distorted or sprained, or if it's actually a meridian. So that was the importance of doing the meditation earlier, where I would like you to feel your qi, your acupressure is at work, especially if at this moment or today you don't feel so good. Then you can actually see the acupressure will work immediately. It's very effective. So this is a F functional MRI that was done in Germany about 30 years ago. You see, I've highlighted 4 points, right? Why do I highlight those? These are just showing that the blue means cooling, the red is inflammatory. So that means that if you put acupuncture pressure or needles on ST36, that's one of the points we will go through, PC6, which we will go through. You can see all the body start lighting up, the brain in the fMRI start lighting up. There are only 18 points here. These are some of the major points. But if you look at NIH or go into NIH research on acupuncture points for nausea, for neuropathy, you will actually see dozens and dozens, if not even hundreds of studies done locally, globally here, or globally throughout the world. So some of the acupressure too, for instance, on this slide, you can see some are rollers, some are pointers, some are made of metal. This ones actually have a battery so you can send vibration through the skin. And this is a jade. These are like different rollers that you see. They all started, but to start with, people usually use your thumb. If you, as the giver, the caregiver, you wanted to do acupressure on someone, first, we use mostly the thumb, right? You want to make sure you don't have arthritis or strains on your thumb or metacarpal bones, because after you do acupressure, maybe you are sprained. Instead of the recipient, you actually penetrate some pain projecting into the person, the recipient. So make sure you do some acupressure on yourself to alleviate the osteo or rheumatoid arthritis or your injury before you apply on someone. So acupressure can be called 按摩、推拿、massage, 指压, deep tissue, Swedish massage, all kind of names, but mostly it's the pressure point of the acupuncture needle that you are pressing on. So here are some of the things I get often asked. So how much pressure? How long do you do it? So first of all, the weight, how much pressure do you put on? Let's say, do I put on this person's elbow? You have to put it on where they just feel the pressure. Maybe a 2 or 3, that's enough. Don't go to all the way to 10. That will be too heavy. Direction of your pressure. Do you go clockwise or counterclockwise? It really doesn't matter. The reason I said that in the acupuncture professional world, yes, it does matter. Do you do clockwise? Do you do counterclockwise? Yes, it does matter. So usually if I say, if you're not that deeply trained with 4,000 hours of training, just remember if you do 20 clockwise, do 20 counterclockwise. You cannot go wrong. Okay. And what about pulsation? Or do you put pressure? Do you just like press, press, press and let go, press and let go, or do you hold on to it? It depends on you. You as the caregiver, I mean, how much power, how much pressure, how much time do you have? And your recipient, your patient, your recipient, how much can they take? If their energy is pretty low that day, low energy like I have on the red, you don't want to do too much. Because when you press down, there's neurotransmitter that transmit to the brain, and you press away the blood. When you push down, the blood starts scattering, right? But you push down, it goes to whichever meridian, you will go to that internal organ that you actually start promoting the flow. For instance, when the patient goes, I feel so exhausted, you can say, well, how about I give you some acupressure? Do very gentle, low energy, low pressure. The patient or the person, the recipient has high energy, screaming loud energy, very young, active body. You can use heavier pressure. You can go from a 2 to 3 to actually a 4 to 5. Never go to 9 or 10 unless the recipient wants to that deep pressure. And if you're working on cancer patients, never go to that high. Go to 2, 3, 4 most, not more than 5. That will be too heavy. Just remember their body is already under a treatment, so you don't want them to expedite or release too much. Okay. And time duration of each point, there is no 15 minutes, 15 seconds. It's whatever time the recipient can tolerate or you can tolerate. My work is for me, when I'm driving at a stop sign, at a traffic light, I just do all my acupressure point on my hand, elbow, my face, and even my tummy. By the time I get home, I'm already done with my acupuncture, my acupressure. So depending on the duration of your recipient, their energy level, how much time you have, don't commit too much to begin with. Maybe just do 3 minutes. Maybe next time you visit, do 5 minutes. Because if you overdo, they may say, don't come back. Don't do my acupressure for me anymore. Just start small, 3 minutes, 4 minutes, 5 minutes, unless the recipient is like, can you do more? Then they ask for more because they feel the space open, and then you can do a little bit more. Increment slowly at a time. Okay, time of the day, it really doesn't matter so long it's not too late at nighttime. If your sleeping time is like 9 p.m. and you visit your friend and you wanted to do some acupressure point, you may overstimulate them and they may not be able to sleep that night. So that's not our intention. So do it earlier in the day when your energy is better, when the recipient, the patient's energy is much better. Do it in the day, in the afternoon. Doesn't matter before you eat, after you eat, before you take a nap, after you take a nap, depending on the recipient and your own energy. You don't want to treat them when you're very exhausted, right? You also exchange the qi from your patient, your recipient, and you. You may make them more tired, more sleepy, right? So depending on time of the day, depending on where you are at and where they are at. Is it doing it for yourself or for others? That also makes a difference. For yourself, you can press, you know how it feels. For others, some of them, they may not be as sensitive to the sensation. Maybe they have neuropathy. They don't feel it. One time I had a 90-year-old patient. He's my friend's father, so I've known him very well. So he was having elbow and shoulder pain. And I start working on acupressure. Within seconds, it become a big black bruise. Oh my God. I said, oh my goodness, what did I do? Every time in that few minutes, no matter where I touch, he bruised up. And I go, oh my goodness, this is really bad. Then he said, I'm on a lot of blood thinner. I go, why didn't I think of that? You were on blood thinner. You're 90 years old. Of course, you may be on blood thinner. So if the patient is on blood thinner, you ask them if you're on blood thinner. If you already see they already have a lot of bruises, or from just by bumping themselves on thin skin on a little bit more senior patient, or some of the treatment like leukemia patient, they have a lot of, they bruise very easily. Their platelets is very low. So you don't want to apply deep pressure. You only can apply 2 to 3, maybe that's the most, and observe. Like my patient, I just put my finger on, I let go of my finger and there's a black bruise. So I felt so bad, but after that I told him and then he understood. And then luckily, nothing happened. So if it's for yourself, for others, ask if they're pregnant. If you have someone who's in the fertile age from 14 to 45, if they ask you to do some acupressure, make sure they're not pregnant, because some of the points can be very strong, can cause, abortion to the patient, or early laboring, which we are not intended to do. And the patients who are on very low blood pressure, they look very pale. Of course, they're very low energy. So when you work on them, go very carefully, very slow. Over maybe 2, 3 times as you do acupressure, they will begin to feel better. And then you can apply for more hours. And look at the patient's skin, the condition. Some of them may have some contagious disease on their hands, then they don't tell you. So that's why when we examine patients, we always wear gloves. It's not like we don't want to touch them. We want to touch them. But if they are contagious and they don't even know they are contagious, you may easily catch what they have. So professionally, we always wear gloves. And then you can also go, oh, this skin looks very strange. You can ask them, what is that rash on your skin? Maybe avoid that side or that area so you don't get contaminated, and make sure you as the caregiver, you wash your hands, and the recipient also wash their hand. So wash their especially you wash your hand. Your recipient doesn't have to wash their hands, but you wash your hands so your hands are completely clean and your mind is very quiet. So do you do both sides or single side? Usually, of course, both sides. As you can see in the previous slides that all the meridian, there's, even though in this paragraph, in this slides, it only shows one side, but all the points are bilateral of both sides, okay? Let's go back to one more slide. Eeks. And who is more suitable and not suitable? Who is a better practitioner who is suitable to work on caregiver, or is the patient suitable to receive that time? It all depends. First of all the cautions I've mentioned, so please do remember these. Remember that. And if, like I said, if you have arthritis in your thumb, you may want to use just something like a pen. On the back of your pen, you can do acupressure. I tell the patient you can do it on yourself. You have a marker, so the back of the pen is much easier, or the back of a pencil with little, so it's not too hard on the patient, right? You can also use some of the gua sha too that you were seeing that's very popular for people use it for faceless. You can see these pointy places. You can use that as a pointy acupressure. Do you see that, right? You can use that, or you can use the dull part, which is round corner, not as sharp, the dull corner you can put on that, right? Instead of using your hand. And people also use dry brushing on different meridian for dry or lymphedema. That's also very possible. Look at this dry brush. You can use the back of the handle and you can use that as an acupressure point, right? You can use that as well. So multiple uses. So really depending on your condition and your recipient, the patient's condition. Never overdo, always underdo a little bit, but ask the recipient to be quiet while you're doing it, and so they can receive. They cannot talk to someone else while you're doing an acupressure. That's totally not okay. The result is poor. Might as well don't do it. Ask them to stop. I'm going to do something very sacred for you. So please, 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 let's both in the same matter. Once you touch the patient, the neurotransmitter, the sensory, the motor skill start acting, not from you, just from you, but the recipient itself. So let's say some of the side effects, diarrhea, constipation, nausea, chemo brain, and pain, and you just don't feel good. If anyone here today doesn't feel good, just try this point. Okay, so you can put your thumb and the index finger together. Okay, and usually at the top of the mouth, I don't know, can you see? Open, and that's where large intestine 4, number 4, also known as Hegu points, is. This point belongs to the large intestine. Large intestine is about excretion, detox, right? So it's good for diarrhea and constipation. Also, when you just don't feel good, a lot of time you could have feeling very nausea, very just not right. Stomach ache, especially children, they go, I don't feel good. My stomach hurt. I have a headache. Like both of my kids, I tell them, just press your Hegu point. I said, don't do anything else. You're not going to listen to me anyway. So just press the Hegu point. So now over time, they complain they don't feel good. I said, just press the Hegu point. Again, we talk previously about pressure, 2, 3, or 4, 5, depending on the recipient, depending on the time, and depending on the age, the condition, patient is on blood thinner. Okay, so large intestine number 4 has multiple use. You saw that fMRI. You can actually bring down the inflammation, right? And you can calm down the what's going on in the head. Very good for head, shoulder, neck, in the upper body problem. You can bring it down or descending down. I didn't put all the NIH or all the PubMeds and research here because there are too many to quote. So you might as well just try it and look it up yourself. Okay. This is from large intestine number 4, the point between the thumb and the index finger, the Hegu point, that look at how much light it showed up. Yellow means large intestine 4, it activates different parts of the brain. Look at that up, you know? And the red represents the sham point. In this article, they actually use this and then they put like a fake point somewhere else and then see it didn't light up. You lit up some places, but look at how yellow, how much place they can actually change the brain, the neurotransmitters, the sensory that you can change. So large intestine 4 is the number 1 point we use. And this one is for called 内观 pericardium number 6. Why do they have a number follow the pericardium? Pericardium meridian, you can see, starts from the corner of the armpit down the medial end in between the 2 tendons, ends up in the middle of the middle finger. So this point, it's about everybody can try 3 fingers. Go ahead, try it. Go ahead. Above the first line of the wrist, 3 finger closed in between the 2 ligaments. And go ahead, press on it. You ever seen those nausea band people use for airplane or boat? This is to activate the parasympathetic nervous system. Again, this point have so many NIH research on it. I'm not going to quote it there, but just go ahead and try. Let's try. Everybody try. Let's press, release. Depending on how do you feel, you can put 2 or 3, or you can use 3, 4, 5, up to 5. Press, slowly release. Did you find between the 2 ligaments, 3 finger above? Try again, press, and breathe, and release. Try the other hand. 3 fingers above the wrist, in between the 2 ligaments. Okay, 3 finger between the 2 ligaments. Go ahead, press. We can hold for 5. Slowly release. Do not do it. Press and just pop open. No. Let the blood come back slowly. Your intention is to help the person with nausea, the nausea that causes them to loss of appetite and cause them weight loss, right? Your intention is good. You want the nausea to get back. Or you can press circles in directions and the other counterclockwise direction. So if you do 5 circles one way, just do another 5 circles the other way. You'll be very safe. Everybody got that? And I hope parasympathetic nervous system can raise your heart rate, your overthinking mind, like your heart rate palpitation, before it actually causes you problem in your health. So palpitation, angina is one of the symptoms we see. So start working on it. Don't wait until it actually become a disease. Then you're in trouble. Okay, I'm gonna go on. Okay, stomach energy pathway. 足三里, stomach number 36. So keep an eye on, this is on the outside of the fibula, outside your legs, not on the inside. So this point is right between where the fibula and the tibia meet. So it's about right there. So acupuncture point is never on a bone. If it's on a bone, how do we put the needles in? It's right. It's next to the bone, next to a nerve, next to a blood vessel. So if you go, I'm pushing on the bone, I think this is the bone, then that's not the right point. Maybe you move away a little bit. So stomach meridian, it works on digestion. Many of the chemo or patient undergoing treatment, they have lost their appetite. They just don't feel good, don't feel like eating. And stomach 36, this point right here on both legs is the most abundant point where the energy and the blood accumulates on this point right here. Okay, so it can actually help you to gain weight, help you to regenerate the nerve and then the digestive system. So it's not like, oh, I'm already overweight, I'm not going to press on that. No, the reason you're overweight, maybe your absorption is off. Maybe your digestion is off. Maybe you are not eating right. So we wanted to press on this point. You can press or make circles until your digestive function comes back. Also very good for fatigue and tiredness. So if you don't eat, you have no energy, right? And the chemotherapy, radiation, all this makes the patient very tired. Maybe the first day, maybe up to a week. The more chemo they get, the more tired they become. And they have lost hair, lost nutrition, lost weight. So these are some points that's far away from the heart, right on the leg. So it's very easy to do, very, very effective for helping them to gain weight. What about neuropathy of the foot? So these points are between each webbing from number big toe, second, third, fourth, and fifth toe. Right on the webbing, you can actually pull, let's say, pretend this is my foot. Pull on the webbing or have the person do it themselves. Pull on the webbing where they can actually go in and do the massages themselves or use a pin and do the massages themselves. Okay, you got that? You got that? Okay, these are called on both feet. So we look at how far the neuropathy is. We will usually ask our patient, where does it start? Is it in the toes or is it has traveling to the ankle or to the legs already? Of course, the earlier we start doing it, we're preventing it, the better. If they don't have neuropathy, but they know this chemo drugs will bring neuropathy maybe after the second or the third time round, start working on it to remove the toxicity that deposits in this distal area of the feet, of the toes. That will be very helpful. What about neuropathy of your fingers, right? Most neuropathy we see are in the foot because they're distal from the heart. So therefore, it's more harder for the circulation to come back. How about neuropathy on the fingers? Yes, they're in the webbing places. You can use that. Or you can use a pin and then go inside and massage. Wouldn't it be better if you use a sharper pin? That would be fine too. But then there's a lot of neurotransmitter here. So you may go, ow, that really hurts. Stop doing it. So just remember, depending on if you're doing it on yourself, you can pull out, or you can use the pin. Depending on the recipient, who is receiving it, are you overdoing it? Generally, 2, 3 is good. If they can take more, 4 or 5 is maximum. Don't overdo. How about overall inflammation? Everybody talks about inflammation, right? So inflammation, you can use all the points I got you earlier. Large intestine 4, this one, 内关 right on the wrist, stomach 36, the one on the outside of the foot on both legs, right outside, and 曲池, large intestine 11. So if you do look, type in, inflammation acupuncture point, all the points I just said will all show up on a lot, too many studies. So this point is located, if you bend your elbow, if you can follow me, put up your sleeves and bend your elbow. Let's see how to, I'm going to See if I can show a little bit better. This point, if you locate it, you have to bend your elbow. Once you bend your elbow, you can see that there's a crease that ends on the outside of the elbow, right? So that point is right in here. I'm going to use a marker. You can see right there. Go ahead, find that point. Now you can open your elbow, but when you close your elbow at the end of the cubital crease, when you end. All right, let's say we found the point. I'm going to sit down and we will go press on it. Okay, very good for inflammation first of the elbow, bursitis, elbow pain, right? And very good since it belongs to the large intestine energy pathway. Also very good for inflammation of the large intestine, constipation, and diarrhea. Also, overall, it will be very good for all the general inflammation in the body. Okay, so on both sides, on the outside of the elbow, not on the inside. Don't get that wrong, on the outside. Okay, and let's go to the next slide. Okay, so that actually finish up what I wanted to share about, the few acupuncture point, the 4 acupuncture point for acupressure that's safe, the neuropathy for the hand, they call the 8 wind, W-I-N-D, and the 8 pathogen on the foot, on the feet neuropathies. All 6 slides will help you to get through everything. And that's my email address on the bottom. So I am going to stop sharing the slide where I can see you. So if you wanted to turn on your video, now will be a good time to turn on. If you want me to check the point or go over the points, I will be more than happy to do that. Did I stop the video yet? Hold on, let's see.
We can still see your screen. There we
Okay,
go.
there we go. Yay.
Yes. Yeah, and there were a couple of questions in the chat. So maybe
Mhm.
um
Sure.
first, I'm not sure if Wendy is still on here. Wendy had a specific question about like a liver qi stagnation. If
Hmm.
there were points for that. Um and so that was something we didn't go over.
Nice.
Yeah.
So liver qi stagnation is a very professional medical term. Liver qi stagnation is actually the #1 cause for having cancer. So I taught at ACTCM for over 13 years on cancer, TCM, and cancer care. So #1 research I found is the liver qi, liver energy stagnation. So to do that, liver qi stagnation people, you actually see high blood pressure, always anger, always frustration, or a lot of like old memory that keep on washing back, a lot of negative energy. And you just store them, store them, store them, not able to release. Sometimes it's impossible to release. Sometimes you just have to release. So one of the things you can do is I'm going to stand up where you will see the profile of my side. Put your hand on the side right here, about number 6, 7 rib cage, right? So this is right in the middle. That's about number 4 and 5. So go ahead, put both palms on the side, and you can go ahead massage. That's the liver on the right hand side, right? That's the spleen and stomach. So go ahead, massage. Everybody try that. Everybody got anger, I'm sure. Nobody is, immune to it. Just go ahead, massage. Shoulders back, shoulder blades pulled back in. Use your palm and just put on the side and go ahead, massage. 2 or 3 or 4 or 5. Okay. So there's other acupuncture points in the liver that you can use for liver qi stagnation. So to avoid liver qi stagnation, first work on the mind and also work on these points. If you know about acupuncture point, liver 3 will be very helpful, which is on the toes. Everybody can see that. Beat and second toe right in the middle, right there. I'm going to point that. So look on both foot. look online for liver qi stagnation, what points to use. So that will be very, very helpful, but mostly massaging. And this massaging, you can do it while you walk around in your office. Any time you have your hands are free, just start massaging it. That's all you have to do. That's all you have to do. Over time, over 2, 3 days, we will see getting better. Also, liver qi stagnation can be caused from the chemical from chemotherapy. So that will be a problem that will store, and that chemical, that toxicity can go to the toes. Since I said earlier, that's the hardest part for the blood to return back to the heart. So often the chemotherapy, the toxicity stores in the toes, and that will also be because of the liver qi. Liver is overtaxed on that. So that will be very, very helpful. Okay.
Great. Thank you. Frenetta was curious if there's a visual scale for the pressure levels you reference. I'm not sure how that would be represented, but she was asking if there was a visual way to know these different levels of pressure.
And you will have to research that yourself online yourself. But mostly is how does it feel to you and how does it feel to the recipient,
Great.
right?
Thank
And then
you.
how much pressure are you putting in that they feel comfortable,
Yeah.
that allowing you to do. Or for instance, they just had surgery. Of course, you wouldn't touch that surgery site, right? You will use very tiny little pressure to help to ease the pain.
Right. Thank you. Annette wanted to know if you had a method to avoid picking up on a loved one's energy or to keep their energy clear while doing acupressure.
Yeah, that's another very good question. Yes. Have you ever felt people who are more sensitive? They can pick up other people's energy. You can walk in the room, you can immediately feel the energy of that room. So you are very intuitive, you're very sensitive. So that means you will be able to receive, but you don't need to restore that energy. You will go, wow. For myself, I may have a patient that coming in with a lot of fear of needles. And how do you not picking up their fear, or who comes in who who just went through something very negative. First, you ground yourself. You stand straight. Your mind is very clear. You are going, I'm just gonna give. I don't want anything back. You already make that intention very clearly, I'm here to give. I don't want to receive what you're giving me, because I wanted to help you. So that would be very good. Always stand, even you're sitting down, your feet should always on the floor. The earth can wash the bad energy that transmits through you, but you cannot, you know, you have to pay attention to what you're doing. And if you're in low energy or you're sick yourself, don't do it that day. Change another day. It's not good for the caregiver, not good for the recipient. So keep that in mind.
Great, thank you. So we have a few people asking for specific points for specific pains. Rosalind is asking about low back pain and hip pain.
Very good. Okay. So lower back pain and hip pain, it depends on if there's a structure problem, if there's a spine problem, or if it's just a muscle tension or spring. No matter what it is, it doesn't matter. I'm going to use hand reflexology to treat the lower back. So you can look at your own hands, right? There are between the fourth and fifth metacarpal bone. These are called the carpal tunnel, right? Metacarpal. This is third and fourth, and second and third. So you see that groove in there? Everybody see that? Okay, Ralph, you have lower back pain. I want you and everybody online, if you can try. This is fourth and fifth is about lower back. Third and fourth is about thoracic. Second, index and middle, it's about neck and shoulder pain. All right. So now you know all of our secret. Okay. So go ahead, find on between fourth and fifth metacarpal. Everybody else do that too. Go ahead, press down, find the most painful spot. If your pain is on the left side, you can try the left side. If your pain is on the right hand side, try the right hand. Go ahead, Ralph, especially Ralph and everybody else. Go ahead, press hard until you find the ouchie point. If you find that, or anyone online find that, go ahead, put pressure on it. When you put pressure on, I want you to do something else. I'm gonna stand up. I want you to moving your back at the same time. I want you to press on it and move your back. That sends a neurotransmitter. Use hand reflexology. There's a part of the nerve that treats the lower back. So you go, but I have thoracic pain. My mid back is always in pain. Then you do 3 and 4. Got that? And my neck, 2 and the 3. So when we go to conferences, or maybe when you go to conferences, usually it's 8 hours or 10 hours long. We are sitting there, just watch the speaker. So often we get back pain, mid back, lower back. So we just start massaging and we start twisting. So if you ever see people doing that, they know the secret to the hand reflexology. Okay, I hope that helps, Ralph.
Great, thank you. Mary and Tim are asking about neuropathy of tongue and throat from chemo.
Oh, yes. That's a hard one, isn't it? It's not comfortable at all. So usually there's probably a lot of tension in the neck from radiation where it becomes very stiff. So they become the nerve, the tongue is very sensitive, has already been damaged. If it's from radiation, you will have a lot of scar tissue. Can you, Mary and Tim, answer that in the chat? If it's from radiation or if it's from chemotherapy. There's a difference.
Chemo. They've said chemo in the original comment.
Okay. All right. So if it's from chemotherapy, there's a lot of toxicity in the body that's actually represent on the most sensitive part, like your tongue, your nerves, like your feet. So if that is the case, you can first maybe you can tell the oncologist about this condition, see if they will lower it. Other than that, usually you may want to check with your oncologist if you can do a little bit detox after 5 days of the chemotherapy. What does that mean? For instance, dandelion tea bags. Okay. After 5th or 6th, the oncologists, they have a Chinese pharmaceutical and drug and herbs encounter handbook. They can look it up. They will go, oh, dandelion will be safe to use. Use dandelion tea and sip it, maybe 2 tea bags, and you can buy them online anywhere. Use 2 tea bags, which is much stronger. Make it hot and start sipping on it every day, maybe 1 cup, 2 bags, and see by the 3rd or the 4th day if that start the diminishing, even just a little bit of the neuropathy of the tongue, because that will be very dangerous. You can bite your tongue and you will not be able to feel it. So see if the dandelion can detox the residual of the chemo. The first few days is when the body absorbs the chemo the most. And that's when you begin to feel, oh, I finally feel better like myself again. That's when you can start using the detox. But ask your oncologist about what I said, and you check on the dandelion to see if it's possible. Other thing you can use is licorice tea. Just the licorice tea will also help to slow down the chemo, but it will not like dissolve all the chemo. So it won't be like, whoa, on your face all at once. Okay, I hope you can try and let me know if it works. Let me know how that goes.
Great, thank you. Luna's asking about hot flashes caused by meds.
So hot flashes is the parasympathetic nervous system not working. It's the sympathetic nervous system too hyper, too much sympathetic nervous system. So encourage that use pericardium number 6 that I said earlier, 3 finger below the first wrist, 3 finger below, and then in between the 2 ligament. Okay, on the inside, we'll hold it in there. 合谷 point right there. Those 2 will pretty much take away all the hot flashes. Of course, if it's from chemotherapy or hormone replacement, or if they have to shut down your hormone because of using some medication. This will minimize, but will not take it away. But eventually, your body in 2 months, in 6 months, will get used to it. And then you can go, oh, I'm finally adjusting. If it's due to the medication, the hormone suppressant medication, you can ask the oncologist to change to, there are 3 types of aromatic medicine that they can switch to another kind if that will suit the purpose to bring down the hot flashes. But, use this, and stay away from high stimulants like spicy food, hot chili peppers, late night eating, sugar, sweets are all very helpful to reduce the hot flashes.
Great. Thank you. So hopefully we have time for 1 or 2 more. Judy is asking about vertigo.
Okay. So vertigo can be caused from eye imbalance. Like if you wear wrong eyeglasses, you can feel vertigo. Could be from inner ear or could be from the cervical where the nerve is blocked. So you always have a little bit vertigo. So in the vertigo, there's a vertical the maneuver you can do, or there's actually vertical acupuncture point in the back of the head. Let me see if I can show it on this little man here. So you can see auto right here, right? You can see I'm gonna turn. Hopefully you can see, maybe not able to see. Under the earlobe, right behind the earlobe, where the earlobe and occipital bones meet, right in the middle, right there, right behind the earlobe. Go ahead and feel that, and go ahead and feel the edge of the occipital bone right in the middle. Those are called the vertical acupuncture points. Very effective, very, very effective for that purpose. So try to find it. Okay, that will be very helpful too. And besides your ear, where your eyes imbalance.
Okay, so maybe 1 more. Donna's asking about dryness from targeted therapy for lung cancer.
Oh, yes. So the lung is always wants to be very moist. So when you take a deep breath, it can actually open. And when you exhale, it can actually close like the door, like elasticity, right? So doing treatment, they wanted to shrink the tumor. So they use maybe high energy radiation or chemotherapy where the lung becomes very dry. When it's very dry, there's no blood supply to the tumor, right? So in this one, you can use the large intestine 11. That will help a lot. Large intestine 4. Large intestine and the lung meridian, they're like partners. So if you massage these points, that will help. I'm gonna do my one last point sharing, and then we will have to end. And so one of the point, if you look, 4th and 5th finger, and in between the joint and the webbing, right? That's the ba feng webbing and the joints. Okay, so what are you going at? Here we go. Right in the middle of the 2 points. Right there. Go ahead. Everybody try. Go ahead. Put your finger not in the knuckle, not in the web, right in the middle. Hold it right there. Does your saliva start coming in? Does the saliva start drooling? You start feeling the moisture coming in? So if you have lung dryness, go ahead, swallow that saliva into your stomach. Go ahead, swallow that. You are generating a lot of fluid now. That will be very helpful for your lungs. Okay.
Well, thank you, Erlene, so much. This is a pleasure as always. You are such a wealth of information, and I hope everyone enjoyed this. We'll be posting the recording in about a week or so on the website, but an email will go out. But it'll live on our blog where you can find our other videos as well. So, Erlene, thank you so much. And we hope to see you again soon. And thank you, everyone, for joining us tonight.
Yes, please support Cancer Choices and take good care of yourself.
Thank you so much, everyone. Have a good night.
Good night. Practice. Okay, bye-bye.